So we are in the fag end of the chemotherapy is concerned, only one or two classes are there. So in this class, we are discussing about the drug abuse in case of the animals or the misuse of the drugs in case of the animals. So especially the drug abuse is a great term in case of the horses, especially the doping is one of the greatest abuse. Apart from this one, the use of the oxytocin and other things are not done by the veterinarians, and hence they will not carry much weightage. So coming to the drug abuse, because this horses, especially if you want to become a equine practitioner, then you need to know about the doses and the drugs, especially which are required for the horses. So many times this say what you call as there are many sayings. I'm a free spirit, because the horse says that either admire me on ground or fly with me. That's but don't ever try to cage me. That's what a horses it say, because the horses are totally and exclusively used for the, particularly in case of the race horses, especially turf clubs and other things. The race horses are prepared, and if they win, they will win crores of rupees, or if they lose, then the crores of rupees of the bidders will go. That's why the everybody wants the horse to win the race, and in this race, so they are going to use varieties of the drugs to artificially increase the strength of the horse, other than that of the regular exercise, maybe feeding or the physiotherapy. So the racing horses. So if you come to the history of this thing, so, around 1,50,000 seats are there in the racing horses. If you can see, because the Julius Caesar was the one first who arranged the racing, especially in the other countries. And similar to modern horses harness of the racing also, then the Europe, lot of tournaments, horse tournaments are arranged, and everybody want their horse to win. So nobody likes the defeated horse, everybody wants the winning horse. So if it is not able to win by its own, so they will make it to win by the shortcut methods like the doping. So I think the varieties of the sports, which include the horses, it is especially the dressage on the Olympics, then cross country like this, then show jumpings. All these are prepared by the horses. And other disciplines, there is a combined drilling, then endurance of riding, then horseback riding, then tent pegging and vaulting. All these, galloping, all these are preferred by the persons who like the sports. But nowadays there is a lot of opposition for the torture of the horses in the name of the races, because it is one of the unethical treatment of the animal, and making the horse to die. Or if it is lame horse is a waste to the turf club is concerned. Hence, they are going to stun it or shoot it. That's so the many of the persons, they feel that this is a animal ethics issue, but still they are unable to stop this particular program. And especially many times, if you are from Kerala and other persons in Tamil Nadu, the Jallikattu and Kambala in Dakshin Kannada, they are banned in the name of the animal tortures. So whereas the still the animal ethics people, they are unable to touch the horses, especially what we can say is the industries which are depending upon the horse. So crores of rupees are being betted on this horse, and if a winning horse is always liked by every person. So why the drugs are used, especially in case of the horses? What is the necessity? Then this is for fame and fortune. The number one, fame. If a horse wins, especially the jockey and other persons, they will get a lot of money. Of course, the horse doesn't know why it is meant for that particular race, why he has to run, etc. But it is being tortured to run fast and win the race. And also, another thing is to cope up with stress and injuries. That's also the drug. Suppose a horse today it fell down and gets lot of injury, that it is being admitted with the non-steroidal anti-inflammatory agents, and also the other muscle relaxants. So this should not happen, and the natural ability is not good enough to win the race. So if it is the case, the many times the horses. So it's a very tough competition between the different turf clubs to, especially in the race course, Bengaluru race course. You might have seen so many horses are running in a particular track and to win each other. So the natural abilities may not be suitable to win enough. Then the most important criteria is economics, because the winning and losing makes a lot of difference to the human being, and so that's why the drugs are being used to dope the horse. Then a drug taken by athlete to improve the performance, it is called as the doping. So you know that nowadays this Olympics and maybe Asiad or many games, many these players in different sports or athletic events, they take the drugs for improving the performance. Especially the, even though the Olympic Committee is so strict in the banning the particular person's participation in the Olympics for the 10 subsequent times, even then they are going to take the drugs and try to improve the performance. So nowadays stringent test protocols are there. Even then what happens is, if new drug is being taken and they are all old testing the old drugs, and there are very much experts to advise this doping, which can be escaped by the checking the blood and urine. So before every sports, it is very compulsory to take the urine and blood sample of each individual and test it for the presence of the drugs. So in 1966, IOC, that is the Indian, especially the medical commission, then whenever there is a violation of ethical principle, especially in case of the sports. So the Indian Olympic Committee and International Olympic Committee, that's the medical commission, they formed a medical commission to test each and every person who participate in Olympics, and will get tested for the drugs consumed. And the dope is the word which derived from the Dutch word, that is the DOPE, means to take some drugs to increase the performance. That's why here a person is having a right horse. This is normal horse. After doping, it is having a lot of musculature and runs very fast. So many cartoons are there. And here there are two type of the dopings are there. One is acute doping. So acute doping and the chronic doping. Here, in case of acute doping, the short-acting drugs like or stimulant drugs. So the drugs are amphetamine, cocaine, and narcotics. Some of the narcotics, they are used especially to reduce the anxiety of the race. Many times this is administered. Amphetamine, cocaine, and the Vashi horses are also one of the thing. And inside the, especially in the race, etc., there are a lot of this particularly the drug is being abused by the jockeys, the horse attendants. So there is a lot of driving for this particular doping also. Whereas in case of chronic medication to win, it includes the vitamins and anabolic steroids. Of course, the administration of the nutraceutical like vitamins is not a very big, what you call as the offense, but the anabolic steroids which retain nitrogen and the build up the proteins, especially those who go to gym and other thing, many times it is said that the anabolic steroids are being injected to build up these six packs. Especially the ladies may like this in boys, the six packs. So to get the six packs, always the anabolic steroids are misused by the persons who especially run the gyms in the high-tech cities like Bengaluru and the metropolitan cities. So that's also one of the greatest misuse of the medication in case of human beings. So and in case of human beings, hundreds of this doping and drug addictions are there, but we will restrict ourselves to the animals is concerned. So, and other thing is the depressants, many type of the depressants, maybe the diazepam or any other thing, because whenever there is a big race or anything, the horses are being disturbed or they are excited and or they have the anxiety. Then to if the anxiety is suppressed, the performance will always be better. That is why the large dose of the tranquilizers like hypnotic, sedatives, the benzodiazepines, benzos, and the barbiturates. So these are all the done, and all these outside jobs are really, really unwanted. Then the medication to restore normal performance, yes, that is also one of the important thing, because in between two races, if the horses do not get sufficient rest, then they cannot run faster like the other horses. So improve the horse performance temporarily. This non-steroidal anti-inflammatory drugs like the phenylbutazone, one of the most indicated non-steroidal anti-inflammatory agent, it is always misused in the horse. And sometimes the corticosteroids. So if a horse get injured by running and there is a wear and tear of the tendon, then the intra-articularly the corticosteroids are administered. The corticosteroids, especially all types of glucocorticoids like the many of the glucocorticoids, dexamethasone, betamethasone, then triamcinolone, then hydrocortisone, and many more short-acting or long-acting. All types of the corticosteroids are misused. And sometimes the local anesthetics like the lignocaine and the lidocaine and many more, they are bupivacaine, etc. So they are used to numb or freeze the local area. So the and also sometimes the fluids and electrolytes, they are permissible under the law. So you can always administer the horse with sufficient quantity of the fluid, but it is not a doping because it's just supporting agent. So you can administer as being the veterinarian. That's why the role of veterinarian is very much important, especially in case of the racing, especially the equine practice is concerned. So if you want to have the equine practice, surely we have got a lot of speakers, especially the chairman of the Hyderabad Turf Club and Bangalore Turf Club, and the major employees are also the veterinarians, and they look the horse and paid very well. So you can also go to the equine industry whenever possible. I will surely arrange for a webinar. So I'm contacting some persons who are present in the turf club and also in and abroad the India, and we will find a good person so that you will have some job opportunities there also. Then the accidental or the technical doping means a clear-cut doping. So there are two types, accidental or technical doping. So procaine, so he is a binding agent with that of the salt, that is especially penicillin. So when you are administering procaine, you need to also administer the procaine, because the procaine is combined with that of the benzyl penicillin instead of benzyl procaine penicillin. Whereas the caffeine, so caffeine, theobromine, and the theobromine, etc., the cocoa husks in the food pellets, they are going to be mixed with that of the horse feed, cocoa husks. So the cocoa husk do contain very huge quantity of the caffeine, and the horse get excited, especially the performance is going to increase. Just after drinking a cup of coffee, definitely your performance is going to increase. But it is permitted in the permissible level, but it is not the thing that need to be done to horses. So and another drug is the Rabaxine, that's the glyceryl glucocolate. So this is also used for a technical doping, means the purposeful doping especially. So nowadays, yes, the persons who are in charge of the horses need to say the dog had a scratch wound and I have used the procaine penicillin. I have not used any abusing pain, but the procaine moiety will also cause some of the centrally acting effects in higher doses. So it is not permitted nowadays. Then especially the medication to dilute other drugs. So this is also more dangerous because if more and more urine goes out, then the concentration of the drug metabolite, which is excreted through the urine, it reduces, so that it will come under or the below the detection level. That's why the furosemide or the high ceiling diuretic and ethacrenic acid and many more thiazide type of the diuretic, they are also misused in the horses. So the then another thing is the medication to mask other drugs, like the if you use this dipyrone and thiamine. So thiamine is a drug, and dipyrone is used as a antagonist. So all these, whenever we measure, definitely the concentration of the thiamine and will come very high, but it is similar to having the structure to that of dipyrone, and it will always escape in the doping test. Then drugs found in the sample from race sources. So this is from a report of Association of Official Racing Chemists, because the race industry or the equine industry is in such a having money lending business, because the Association of Official Racing Chemists, so they started to list out the drug which can be used officially, not used, etc. So the drugs which are found regularly in the blood of the horse are like the procaine, then caffeine, then amphetamine, ephedrine, amphetamine, and tyramine. All these are indirectly acting sympathomimetic amines. The phenobarbital is a barbiturate, then phenylbutazone, you know that it's a very well known, and especially in case of horses, the phenylbutazone is a non-steroidal anti-inflammatory agent. Then the theobromine, etc., coca, from coca, then the barbiturates, they are the centrally acting depressants. So these are all also used. Apart from this one, the ephedrine, then morphine, then thiamine. So why the morphine is used is to make the animal not to feel pain, and also anti-anxiety agents. So other than this one, the thiamine is also used to mask the effect of the other drugs. They say that yes, especially the dipyrone and the other drugs, their metabolite is very similar to that of the thiamine and get confused. Then other than the amphetamine, the methamphetamine is another congener, and also the nicothamide. So it is a centrally acting stimulant, especially respiratory stimulant. Nicothamide is available as the chloramine injection. Then, of course, the methylphenidate, then strychnine. In very small quantity, both of these drugs, even though they are toxic, they are used, especially in case of the horses. So these traces of any of these drugs, if they are found in the horse urine, then it is always, especially they are always indicate that the horse is doped with certain drugs. So then the drugs having potential stimulant actions. So methylamphetamine, so it is having a 2+ speed, very fastly it's going to stimulate. Then methylphenidate or the pamolin, it stimulates the central nervous system. Then ephedrine, amphetamine, and tyramine, caffeine, they are indirectly acting sympathomimetic amines. So these stimulate the CNS and the cardiovascular system also, so that more and more blood is gushed to the muscles and the performance is increased. So apart from this one, the nitroglycerin is a vasodilator. So always nitroglycerin is used whenever there is a cardiac arrest or the angina pectoris. So to relax the blood vessels, it is used. Then the drugs having potential depressant actions. So if you just read the name of the morphine, so it is a centrally acting analgesic and depressant. So this is also one of the most important doping agent. But Nowadays, they are finding the minute quantity of the morphine in the urine and the blood of the animal also. So always they will be banned. Then atropine. So this atropine is a immobilizing agent. Then espromazine and phenobarbital. So all these are the tranquilizers. Then they cause the depression in the higher dose. Then apart from this one, the promazine, acetaminophen, azaperam, all these are the classical tranquilizers. Especially they have got the doping effect, even though it's not exactly understood how much percent of these drugs are used. Then phenylbutazone, of course, a very commonly used agent, and if the urine of the animal, if it is found to be having the traces of the phenylbutazone, it will be banned for few years if it is found to be dope. So there are already so many stories are there, especially about the doping. You know that Mike Tyson and other persons, they got catched in the doping test and got banned. Maybe the Diego Maradona also, he was banned for many years for participating in the football. So similarly, this especially Jock Paget and Clifton. So we may be knowing these persons, especially these persons banned from Land Rover Burghley horse trials in the year 2015. So it is a very stringent measures are there. In spite of that one, there are the persons are using the doping material. So another one of the drug which was found in blood of these persons is having the reserpine, which is derived from Rauwolfia tetraphila. So this is a vesicular stabilizing agent, and hence the particularly it causes anti-depression action. So they were suspended from the competitions for so many years, and you know what are all the stories behind this thing. Whereas the mechanism of action of the reserpine, it rapid release of serotonin and norepinephrine. So it causes the reserpine causes the depletion of the vesicular cells, and it releases the very fast early onset the serotonin and also the other drug norepinephrine. Whereas the rapid distribution by the enzyme, it is converted by the monoamine oxidases to the active form, then it has got the reserpine has got the calming and relaxing effect. Both are there. So this drug, the reserpine, is a very good old drug, and at that time also Rauwolfia turpentina was fed to the racing horses. Then phenylbutazone, a common painkiller and anti-inflammatory drug. It is known as the bute. Vinyl bute is, so it is this shortened as bute. Half-life is 7.22 hours. Usually it is 7 hours. So very fastly one need to detect this drug in the blood of the horse. Then what is wrong with you? Why you are going to avoid the doping is, first of all, it is the number one is it is unethical to make the animal to administer certain drugs to win the race. So the horse may race, but the many percent will lose without any judicial competition. That's what later the mood disorders or the roid rage. Then also it causes the hepatocellular damage, maybe hepatocellular carcinoma, what say they say. Then it doesn't mean that every time this should come, but it is one of the fact also. Then arrhythmia, especially cardiac problem, fluttering, and the congestive heart failure, immediately they start especially the blood and this money and the blood are snatched. Then the musculoskeletal effects are very if you use these doping agents, then the musculoskeletal efforts will be more and more. So there is increased mortality rate will be seen because the drug may have the adverse effect on the heart. what happens if you use the analgesic agent like phenylbutazone? So this is one of the greatest controversy. Many say that nothing is going to happen after analgesic injections and should be included in the non-doping agents. So the drugs that can be used in horses, many of them say. Then it prevents the muscle tear or the wear and tear of the muscles. Many times the horses may get severe injury, but the next day it becomes ready due to the administration of the doping agent, that is the phenylbutazone. So it causes the acute kidney problem or subacute or sometimes the chronic kidney failure. And also the high blood pressure is maintained. Then cardiac problems like the heart rate, heart attacks will be more and more in case of the drug addicted persons. Then stimulants, these reduce the feeling of the tiredness and stimulate the central nervous system. Tiredness and this what do you call as the central nervous system stimulating agent. So all these are not working. Okay, then the side effects are irritability and sleepiness. So it occurs because these drugs are affecting on the central nervous system. And apart from this one, the blood pressure is going to increase to the greater extent. That's called as the high BP. Then also the irregular and faster heartbeats. So all these are the side effects of the stimulant. The narcotic analgesics, so you know the narcotic analgesics like the morphine and the derivatives, they are always used as the cheapest sources for the narcotic effect. So this reduces the anxiety, especially induced in both the horse and also in case of owner. Then the lot of side effects are there to the morphine. If any of you are having seen this thing, you should always report. And then what happens, just like a drunken man, loss of balance, loss of coordination, all this will happen. Then the diuretics, yes, they are also used or misused. Here there is no dose, etc. Whatever the quantity they require, they administer it. Whereas these diuretics cause a rapid weight loss. So many times in case of human beings also, to reduce the weight, continuous diuretic administration is made, but that is not at all wanted or warranted. Then side effects of the diuresis, as usual, the water quantity will be lost through the sweat, and also the dehydration occurs. Then urine output will also make more and more dehydration. Then there is a muscle cramps will be there, then headache, then nausea. All these side effects are seen in case of the diuretic toxicity that you are learned, especially in case of the diuretics drugs. So beta 2 adrenergic agonists. So they cause the increase in muscle mass, increase in cardiac output, then increase in the lipolysis, then sometimes the bronchodilation, so that the animal can take more and more air through the lungs. Whereas the side effects, all this, the tachycardia, increase in muscle tremors, then sometimes the headaches are also seen, and anxiety and the restlessness. All these are the unwanted side effects. So you may be very much interested to see what are all the samples collected for doping tests before the run race or any type of the race are converted. This number one, the urine. The second one is the blood. Third one is the saliva. Many times the blood may not contain it, but sometimes the saliva also contain. Then hair particles. Hair particles many times they do contain the high quantity of the doping agent. That's why it is also done. So what are all the drug screening methods regularly? Suppose if a new horse comes today for race and tomorrow there is a horse, this race riding or race is there. Then the regular doping tests are number one, the acids and the diuretics, whereas it is selected from LCHRMS. Usually, HRMS is required, and then corticosteroids, that's the CLHRMs. Whereas the acid base or the neutralized, then the anabolic steroids. So these are very commonly misused drug, anabolic steroid. Then the ELISA screens. So this is submarine. So whereas this is stated by the inductivity couple mass spectroscopy, that is ICP-MS, mass spectroscopy. So in minute quantity as also these are being detected nowadays. So we have got very advanced technology for doping testing. Though then there is a threshold for everything. So suppose can say that no drugs should be used. Yes, it can be used, but the dose should not be more and more. It should be this in the level of the decreased uptake or the so they tackle particular issue with respect to endogenous substances. So many times the morphine is also released in the body, then it should not be confused with that of the exogenous morphine. So the environmental contamination or the dietary supplements, they may also contain the drugs which are unwanted, not to be used in case of the horses. The example is these are very similar to that of the natural body fluids. Many times it go waste or it escapes the test. Then the hydrocortisons are very commonly used as a local inflammatory agents or systemic also. Whereas the dimethyl sulfoxide or the DMSO or the arsenic cobalt, all these are used for the doping test. Then unregulated supplements of the market. So avoid inadvertent contamination. Suppose if you are contaminating the horse feed with that of the coca leaves, then it is also called as the doping technique. So there is a agency known as WADA, means World Anti-Doping Agency. So it has got the control of the persons from World Health Organization or international organizations. So this drug affected raising the performance, which is totally prohibited. Then therapeutic medicines, yes, it is prohibited. This provided. Suppose if you administer the morphine to a dog, this horse, if it is certified that this is necessary for the sports, then it cannot be a addictive drug. So there are once again divisions, few of the substances and methods prohibited to all the horses. So in and out of the competition also, whether it is in the competition or whether there is no competition also, many persons feed this material and the owner may get lot of profit. So they are clearly classified now, the doping, international doping agency. So they have clarified the drugs, they should not be used in case of the methods which are prohibiting this competition. So once upon a time, used to see thousands of persons are sitting on long benches and try to encourage the cricketers. So similarly, this is also not wanted, because these methods do artificially or when the other persons when they commit it, then these are going to increase the performance, that is unnaturally increasing the performance. So varieties of the substances are there. Then prohibited sustained substances and the methods are. So there is whether we should come with the real fight, not by cheating. That's how the dope says. Then the surveillance stimulants, then narcotics, then cannabinoids, then glucocorticoids. All these are the prohibited substances to be used in case of the horses. Whereas the prohibited methods are also there. It's also called as the doping. Even though the owner is not going to give any extra drug, but sometimes the manipulation of the blood and blood components is also done. Then the another method which is readily used by the many of the persons, especially the vets, they use the prohibited medicines for the regular therapy. So then also third is the gene doping is also there. We'll see what is that gene doping. Then the prohibited substances in the particular sports. So they have restricted that this is a very big menace and very difficult to treat also. Hence, they prohibited totally the particular substances like the prohibited one, that is the alcohol. Alcohol should never be consumed, even very minute quantity also. It takes the big attention of the Olympics persons. So the beta blockers banned nowadays because the misuse of these drugs in poultry, these horses and other practices. So ethical concern is the number two. Ethically, it is not correct to win without the capacity. Then legal concern is also there because the matter will end up in court of law. Then certain prohibited substances and methods are there. Then in and out competition. So the prohibited substances, they are called as the stimulants and the narcotics. So they are also very important materials. Then the blood doping is another term. It is used to increase the total RBC mass. You may ask, what is the importance of increasing the RBC mass? Is the as and when more and more RBC are there, then they will draw more and more oxygen. Then the performance will be increased. So the side effect of the blood doping is the blood color or the blood will increase in its viscosity, then hypertension, the renal damage, then also there is a weight gain. So ultimately we need to say no to doping because it is always discouraged. Then the gene doping, it is a non-therapeutic use of the cells of the genes, then genetic elements, modulation of the gene expression, having capacity to improve athletic performance. So nowadays this is becoming lot of importance because it is very difficult to test whether the genetic doping has been done or not, because many times the gene contamination studies are yet to come up with lot of the advanced type of thing. So the cheating persons are always there and they do try to treat or make the people fool and also want to win without any effort. Then insulin like growth factor, then in 2003, gene mapping was, doping was banned by the World Association of the doping acceptance. So the non-therapeutic use of these cells, so they were totally banned in case of 2003. But nobody knows that what are all the doping agents. Many times the newer and newer drugs are also there, and some adverse effect of the drugs is also used as the for doping activity. So ultimately what is the conclusion is you and your horse both need to stay very well for a long time without any doping, and his strength and beats, especially your knowledge and the performance. So the knowledge and performance should always be synced, and when these partnership makes then wonders. Then if all these criteria are fulfilled, why you need the doping? That's a big question. But still, the people will not understand, and they use the injured horse only because of its reputation. So victory, there is a great saying that the victory is having done your best. Your 100% is always best. Whereas not winning the game is also one of the things. So you have to win the game with efficacy. That's all, with ethics. That is very, very important. And with this, we are going to close the chapter about especially the doping is concerned. Just I will take this bio enhancers, only a few slides, so that we are going to finish it very soon. So that Monday onwards we can take the toxicology also.